I'm finally starting to feel better 2 months post 2 concussion injuries. Can I go back to hardcore workouts or should I continue to ease back into things? It depends on what you're doing right now. Like if you're typically on an exercise protocol, what we tell people to do, usually what we do is we test them first. So we put them on the treadmill and we have them ramp up their heart rate to try and see at what point they become symptomatic or at what point their symptoms get worse. Typically what you're looking for is an increase in your starting point symptoms. So let's say if you took all of your symptoms together and said, how do I feel overall from 0 to 10? 10 being, the worst you could ever possibly imagine. 0 being that you have no symptoms whatsoever, you feel great. That's your starting point. So if I'm just sitting here right now and I say, okay, my symptoms overall are a 3 out of 10. What we do when we put you on the treadmill is we're looking for an increase, a substantial increase in your symptoms, not just, oh, I feel a little twinge here or I'm starting to get a little bit of a headache here. I want to see your overall symptoms, all of your symptoms combined. You need to have a 3 or more point increase in those symptoms from your pre-test score. So if I ask you before you get on the treadmill, how do you feel today overall? 10 being the worst, 0 being 100% back to normal. Where do you say you're at? They say, 3 or 4, put them on the treadmill, and then they start going. And then I say, okay, how are you feeling now? They say, oh, I'm at a 4. Okay, great. So that's a 1 point increase. Not enough to stop my test yet. We keep going. So I want to see a substantial increase. So 3 or more points. And then once I know where they're at, so if they have that increase, then I take a look at their heart rate. How high was your heart rate at that point? And then we say that's your threshold. So then we take that heart rate, whatever heart rate they were able to achieve, but when their symptoms spiked, and we subtract 20 or 30%, or sorry, 10 to 20% off that. So we want them exercising at 80 to 90% of their threshold. So your threshold is when you had that increase in symptoms. So I take 80 to 90% of that and I have you start exercising every single day for 20 to 30 minutes at that 80 to 90% heart rate threshold. And you're doing steady state exercise. I don't want you going up and down and up and down and up and down, because if your threshold is here and you spike above it, you're just going to make yourself symptomatic. So sometimes people will say, well, can I go back to weight training and things like that? It depends on where you're at. If I put you on the treadmill and you get your heart rate up to full maximal exertion and you don't have any increase in symptoms, that means that you don't have a blood flow issue. You don't have an autonomic nervous system issue. So what I would tell you to do is start with steady state exercise as hard as you want. There's no threshold, there's no risk, and then get back into weights when you feel you want to give it a try. But if you have a threshold, if you have that threshold, if you fail that test and you have a certain threshold that once you get your heart rate above that, you become symptomatic, I'm not going to tell you to go back to weights, because what's happening is you're going to spike above that threshold and create problems for yourself. So your question was, I'm finally starting to feel better 2 months post 2 concussion injuries. Can I go back to hardcore workouts or should I continue to ease back into things? It depends on where you're at now. Are you exercising right now? If not, I would start with steady state cardio, and I would just I would get a heart rate monitor. You can buy them on Amazon or anywhere else. I think most places are probably closed though, so Amazon's your best bet. Heart rate monitor on, go for a walk. Figure out what your heart rate is, monitor how you feel during your walk. It's mostly during. Don't worry about after, mostly during. Okay, if you feel good at a heart rate of 100 beats while you're on your walk, tomorrow bump it up to 105, see how you do. And keep doing that until you find if you have a threshold or not. Once you can get your heart rate up to, let's say you can jog, you can get your heart rate up to 150, 160 beats per minute jogging, right? And all this is age dependent. So depending on your age, that's where your threshold heart rate should be, or your max heart rate should be. If you're able to get yourself up to a jog and you feel fine, well, now you can start looking at pushing yourself, going back into hardcore, trying sets of things. Because what happens when you do sets of things is your heart rate spikes and then it comes back down when you're resting and then it spikes. That's generally harder for your physiology to work with, right? Because it's constantly fluctuating. So if you have an impairment in those mechanisms, now it has to alter itself repeatedly, which is more difficult of a task for it to do. So what you can do is just do steady state cardio to get your physiology used to having a high heart rate, having good blood flow. Then you can worry about changing the fluctuations with it by doing sets of things and going back into hardcore workouts. So I guess I just need to know more information about where you're at. If you're not exercising at all, start slow and build, but always steady state. if you're already at your max steady state